March is National Kidney Month. And so in honor of that, I am interviewing a kidney disease expert and registered dietitian, Jen Hernandez. And I hope you all will take something away from this episode that is in alignment with a lot of the episodes that I do around learning how to not fear food so much and to use it as a tool for your body and not as a cure, not as something that is to be strict or rigid. And I think Jen did a really good job at further emphasizing that point. And as I am coming back from hosting my first national conference that was geared towards therapists and physical therapists, I would love to invite you all back to share with me what you'd like to see in our next monthly workshop. I have someone signed up for May, but I don't have anyone signed up for April. So let me know what you'd like to hear, what topics you'd like to hear, remembering that my monthly workshops are all about some kind of educational component around living with a chronic illness. So we've done things like sex and chronic pain, which also we have a support group for in the Welcome to the Waiting Room membership. That's $17 a month. We've also done, topics like how to not feel like a burden and parenting when you have kids with high sensory needs or you yourself have high sensory needs, financial wellness when you have chronic medical bills, creating a restorative home, how to set up your home in a way that is sensory friendly and built for support for chronic illness recovery. All types of workshops, which again, you can find all of those replays too in the Welcome to the Waiting Room membership. That is $17 a month. I keep that low cost as my way of trying my best to provide the most accessible education and support that I can within my own limitations. So I will put a link below for you all to just click and let me know what topic would you like to hear next. And even if it's a repeat of one that maybe I've done in the past, but you'd like to hear a little bit of a different angle, I would love for you to just let me know what you would like to hear, and I will try to make it happen. So without further ado, here is today's episode. The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learn here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Jen Hernandez is a nationally recognized registered dietitian, board-certified specialist in renal nutrition, and author of Plant-Powered Kidney Nutrition. In 2018, Jen founded Plant-Powered Kidneys, a virtual private practice and educational hub for people with chronic kidney disease. Jen helps people in all stages of kidney disease, focusing on evidence-based nutrition and lifestyle guidelines. And the clients and students of Plant-Powered Kidneys learn to preserve their kidney function so they can delay or even prevent kidney failure and dialysis. Thank you, Jen, for being here.
Thanks so much, Anthony.
Yes, so we haven't done an episode on kidney disease yet, but I've definitely worked with people with kidney disease, and I'm really looking forward to talking about some of the myths and misconceptions around diet and what that is supposed to look like for somebody managing kidney disease. So I think that's what we'll get into today. But first, I would love for you to tell the audience more about your work, what you're doing these days, and what is really passionate for you. What topics are passionate for you right now?
Yeah. Well, as you mentioned, I have been focused on Plant-Powered Kidneys, which is my private practice / resource center, everything that I do for people with chronic kidney disease. And I started this back in 2018 when I was still working in the National Kidney Foundation and dialysis. And I was just kind of like working with the National Kidney Foundation. It really reminded me and inspired me, like, prevention matters, and it makes a difference in a chronic illness like CKD. And then in dialysis, working there, just having patient after patient come into the clinic, and they're just like, I always tell people it's like the deer in headlights look. Like, they're just, I didn't see this coming. I had no idea. And that's a lot of the new patient perception is like, it totally hit out of the blue. They had no idea. And then there's this other group of the patient population where Like, I remember interviewing some new patients who were like, "Oh yeah, I knew I was gonna be in this dialysis chair from like day one. My auntie's over here, my cousin's over there." They would say, "Oh yeah, basically I've known people in dialysis my entire life." It was like an expected outcome. Like there was no choice in it. They already knew their future in this. And it broke my heart, especially as a dietitian with the things that I had learned and was continuing to learn. Because even in that time of my life, I was studying for the board certification to become a renal specialized dietitian. So I was learning so much more on the CKD side while working in dialysis. And I was just like, you know what? Something has to change here. And so I started just posting on social media and writing blogs on my website to educate people about chronic kidney disease and to help them learn that it is not an inevitability. You don't automatically, you're not destined for dialysis just because you have chronic kidney disease, despite what, even to this day, so many healthcare professionals will tell people. They'll just say, oh, don't worry about your diet, or, it's not a big deal. We'll just take care of this when you're in dialysis. Or like, personally, my worst thing is when I hear people say, "Oh, my doctor said I don't need a dietitian yet because I'm going to get one once I start dialysis." And it's like, you could have a dietitian now. Like, why are we doing this? Why are we waiting? But it's just even to this day, it's a very common misconception that people think that they're just destined for dialysis and kidney failure because they have kidney disease. But the research shows it. I have so many students and clients that have proven time and time again that you can make changes that are incredibly impactful for your future that don't result in dialysis and kidney failure. So I can't say it's a guarantee because chronic kidney disease still is an uncured disease. So it still is a lifetime illness. But it's not just a destined you will automatically have kidney failure. That's just not how it works. So that's really where all this passion comes from. It's my full-time job that I spend all my time educating people and telling people how they can make changes in their lifestyle to prevent kidney failure. So that's basically my big thing. And my most proud achievement to date is my book that just I published at the end of last year. Um, and I'm so proud. I never thought that I would be a person to say I'm an author, but this book is on Amazon. It's Plant-Powered Kidney Nutrition, and it's been really well reviewed. I've had so many great comments, which I spent a year writing this book, and I was absolutely terrified when I put it out there because, you're just opening yourself up to you're opening yourself up to public scrutiny and the reviews. But I've had such great reviews for the book that it really helped. And so I'm absolutely excited, thrilled that I have something that I can provide to people who I can't work with one-on-one. I can't work with directly, but I have a resource that has the ability to multiply and make an impact on chronic kidney disease.
I think that's amazing. Congratulations on the book. I would love to know what, some of the most important tenets in the book are. What are the things that you feel like every person with chronic kidney disease, or even, maybe before that diagnosis as well, should start to know?
Well, the book is the book is packed with, I really did try to make sure that I answered as many questions and as many nutritional related thoughts as possible with the book. It is primarily written for people in the earlier, moderate, mild stages of chronic kidney disease. I have had people say well, I'm on dialysis. Is this okay for me? And you'll probably learn some things from the book, even not on dialysis, but it's not necessarily nutritionally relevant to dialysis. That's kind of a little bit of a different nutrition pathway, but there are a lot of things that you probably could learn. And if you are on dialysis, it would be a great resource for you to share with your family members who are at an increased risk of kidney disease or dialysis. So you could get the book and share it with your family to say, you have a higher risk. So here's some information that you might, want to be wary of. Some of the chapters I think, that are probably the most important. For one is oxalates. And initially I wasn't going to include a chapter on oxalates because it's kind of it's not really directly related with chronic kidney disease, as in most people with kidney disease don't have to worry about oxalates. It's a very, very big trendy thing right now. A lot of people are talking about the fear and scare about oxalates, but it's not really a common issue in the CKD world, if that makes sense. Like chronic kidney disease. With kidney stones, yes, it's a big topic. But I was like, you know what, this is kind of a little like aside. But then I had one of my early readers, they were reading the book and they're like, oh my gosh, like I have so many questions about oxalates. And I was like, oh, okay, okay. Like it was just one person who said I need this. And I was like, fine. So I added a chapter in on oxalates to explain in the event you have issues with oxalates, this is what to pay attention to. And then other kind of nutritional interventions or things to look at before eliminating oxalates, because oxalates themselves are not typically a problem unless you have high blood or urine levels of oxalates.
Okay.
Otherwise, avoiding foods rich in oxalate is only going to cause more nutritional deficiencies because of all the other nutrients that are commonly associated with high oxalate food, like spinach and nuts and seeds and beans, and soy. So we don't want to cut all these.
What is the fear around oxalates?
So it's a lot of like social media stuff. It's a lot of pseudoscience, and people are saying, oh, oxalates are considered an anti-nutrient. That's like a
Mhm.
fun term, and it's a fun term that people like to use to like scare people to be like, oh my gosh, this is so bad. But that's not really how it works. In people who have high levels of oxalates, then yes, that can be a problem because the number one type of kidney stone, which impacts about 10% of the world, I believe it is, um, the oxalates are a problem, but cutting out the oxalates isn't the first intervention. So when they're saying, oh, oxalates are so bad for you, like, no, your body can manage and take care of and eliminate oxalates just fine the majority of the time. And if they can't, then there's other things to be focusing on.
What are some of the other things that would happen if somebody had a high oxalates? You wouldn't take spinach out of their diet, but you would do something else.
No, that would not be my first intervention. I mean, if it was extremely high, then possibly, but the most helpful thing from a clinician standpoint is to get a 24-hour urinalysis. And from there, you can look at other potential factors, such as how much calcium they have or how much calcium they're missing is more often the case if they're not getting enough calcium to bind to the oxalate, because the calcium can prevent the stones from forming. So if you're getting a lot of oxalate, okay, that's one thing. But if you're not getting enough calcium, like that's an easy thing to do, is to get more calcium with your food to just take care of the oxalate on its own. And then you don't have to cut out those foods. So calcium is one thing, and it's a big thing because a lot of us don't get nearly enough calcium, especially when we're on these kicks of like avoiding a lot of scary foods, thinking that we can't have them.
It's
So calcium for sure. The other thing is sodium. And the majority of us, regardless of our medical history or medical background, the majority of us get way more salt than we need to, like 1,000 milligrams a day more than we need. And high salt that can be a big influence on the creation of kidney stones. So again,
yeah.
let's say you're cutting out oxalates, or you're trying to cut down on some, your body still creates oxalates on its own. So it's going to create them anyway. And if you're adding in the salt, you're increasing that risk of the kidney stone formation. So cutting down on salt is really helpful. And then the other thing that's incredibly important is staying incredibly hydrated. People who are prone to kidney stones, then they need to be producing about 2 liters or so of urine per day. They should be drinking 2 to 3 liters of fluids per day. So that's something that a lot of people don't get enough of, is just staying that hydrated, because it can be kind of a challenge
Yeah,
to drink
it
that
is.
water. Yeah. Like even just the general population, drinking
Yeah.
enough is one thing, but when you have like the threat of a kidney stone, like it's
Yeah.
scary. It's a scary challenge.
What are some of your favorite calcium sources?
I mean, for one, I think just like yogurt is so easy and it's so accessible. Even like when you go to a coffee shop or even convenience stores these days, like yogurt is just very, very easily accessible. And just low fat yogurt is great. Look for some that are like kind of lower in the added sugars, but if all you can find is the added sugar, like you're going to get the calcium from the yogurt. So that's great. Again, like same thing for convenience stores, that you can get like those bottles of chocolate milk or just regular plain low fat milk. Easy way to get calcium in. So those are some great options. Cottage cheese is another
So
one.
pro dairy.
Yeah. Oh yeah. I mean, and there are greens, and so again, like there is calcium in the greens that are considered higher in oxalate, but that calcium is helping to kind of reduce the actual oxalate load from those foods. So there's a lot of nuance into it. So it's just never as simple as like, oh, cut out spinach and you'll be fine with your
Yeah.
oxalates. It's just, there's so much more behind it.
Yeah, which is why your field exists. And, yeah. My other question is for folks with POTS. And, of course, the number one thing is to drink salt throughout the day. What happens when two conditions, the necessary treatment protocols for two conditions clash?
Yeah, I mean, that's a great example of why there's no such thing as like one renal diet, or there's no such thing as one kidney diet. And even when I tell people, I give an example of something, I'll say it's appropriate for like 99% of the kidney disease population. I can't account for everybody. There are going to be some exceptions. And those would be an example of an exception that would not be restricting sodium so much because of the way their body is handling the salt. And so there is going to be a bit more of a nuance there to not be so salt restrictive. And it's quite the balance, because with chronic kidney disease, the hypertension or high blood pressure is one of the top two causes. The top cause is diabetes. So hypertension is up there. And the other challenge is that the kidneys are responsible for controlling our blood pressure. So in a lot of cases, even when, let's say, blood pressure is fine, but you have a CKD diagnosis, if the chronic kidney disease progresses, it continues to lose the ability in taking care of blood pressure. And so it can lead to higher or uncontrolled blood pressure. So it's tough when we're balancing those things. And again, when you have POTS and CKD, that's even more reason to be talking with your provider for working with a dietitian, because doctors, physicians are great at what they do, especially on the medical management, the medication management side, but they're just not trained, nor do they have the time. And that's probably the most important thing. They don't have the time to dig into all of the nutrition related to these concerns. So even if they do give like a one sentence statement of like, watch your sodium or watch your salt, to me as a dietitian, I'm like, watch it do what? Like, watch it go up, watch it go down. Don't add any, like, what do you mean? But they don't have the time to get into it. So it's really, really important to work with a dietitian to get more of that individualized care. And a dietitian can spend that time doing a full food journal review and then looking at your labs and showing you those associations between the two to say, okay, well, you see here, like the 2 days leading up to your lab draw, your food journal was showing that you were getting 3,500 milligrams of sodium per day. And so this is related to your labs because of where your sodium level is at, where your chloride level is at, where your blood pressure level is at. Like, they're going to be able to make those connections and help you as the what I call the quarterback of the healthcare team. You are the main person as the patient. It's going to help you have a better understanding to kind of be armed with more of that information from that nutrition expert.
Yeah, you talked a little bit about something that gets too much airtime, oxalates. Can you tell me about something that maybe you wrote about that doesn't get enough airtime? What are people not talking enough about that you just, yeah.
Yeah, I think one of the things, and maybe it's just, I'll rephrase your question in a way
Sure.
of it's not getting enough of the correct airtime.
Yeah, yeah.
Because another area of chronic kidney disease that a lot of people are incredibly confused about is potassium. And it has historically been really bad. It's been something that if you have chronic kidney disease, potassium is not okay. And even when I was working in dialysis back in 2015, okay, 10 years ago, when I was working back in dialysis, this was something that I would tell people, like, no, potassium is not good. You have to cut out beans. You can't eat oranges. You can't have bananas, tomatoes, potatoes, avocado, like all that stuff. It's not good because you have kidney disease. But the newest guidelines and the research is telling us that that's just not really the case. And it's a lot more nuanced than we thought it was. And the group that I'm most concerned about for this are the people in like stage 3, 3A, 3B chronic kidney disease, who are being left in the weeds because they go online and they're looking up all this information for kidney diet, like what's the best kidney diet? What should I be eating on a kidney diet? I'm stage 3. What should I be eating? They're not getting a ton of information. And the stuff that they do come across, it's not clarified on the stage or situation like whether it's late stage CKD versus dialysis, like dialysis dependent kidney disease. It's just not clarified. It's just like, oh, you have kidney disease. Don't eat all these foods. In early stages of chronic kidney disease, potassium is so important. And 98% of us in America do not get enough potassium to begin with. So imagine you learn about this new diagnosis, your stage 3 chronic kidney disease, and you go on the internet and you see all the stuff about avoiding all these foods with potassium. And they're like, oh, well, I have kidney disease. I can't eat potassium. But you were already at like, let's say 2,500 milligrams is usually what I see, which is about half of the amount of potassium we should be eating in a day to support like our heart health. Potassium's really great for cardiovascular health, really great for blood pressure too, which is ironic because of the whole blood pressure kidney disease connection. But when somebody who's not eating enough potassium is then reading all this stuff to cut out potassium, and then they're eating even less potassium, they are unknowingly avoiding this nutrient that is potentially so helpful in protecting their kidney health, in keeping their blood pressure controlled, in providing other nutrients associated with high potassium foods. Because again, these nutrients aren't just like individual, one nutrient per food. You have something like a potato, which is rich in potassium, but it's also rich in fiber. And again, something most of us don't get enough of. It is a very satiating food, which helps us enjoy our meals even more. It has manganese in it. It has magnesium in it. Even some of the potato varieties have some vitamin C in it. So it's just a great food to include. But again, in so many cases, somebody in stage 3 reads all this stuff online that says you shouldn't be having potassium. And there's not much more of an explanation given besides you have kidney disease. And that's it. And even providers will give the same kind of information. And that's one of my dead giveaways. I tell people, like, if you have a provider who is telling you to avoid potassium simply because you have kidney disease, either one, they're not keeping up with the guidelines, or two, they're just not digging in deep enough to talk with you about what's actually going on there. Because there might be a situation where somebody might need to limit their potassium with chronic kidney disease. It's not very common, like about 10 to 20%, but that's a lot less than what we used to think. But there are so many things going on that can cause potassium issues that are totally unrelated to the potassium we eat, and people just aren't investigating those causes. And so I feel like it's a big disservice to people.
Yeah,
They just don't.
that seems to be like across the board, like cholesterol. We like maybe what I've heard is that how much cholesterol you eat isn't the same as how much cholesterol is in your blood, or like, is this a common kind of misconception across different nutrients?
Yeah, it really can be. And the frustrating thing about this is nutritional science is such a baby science in the grand scheme of things. Like, it is so new. And not only that, it is so hard to get nutritional research accomplished. And I tell people, especially in the CKD population, if they're looking into something, you can't just look at it from the nutrition research of the general population. You have to look at it, was there any research done into the population of people with chronic kidney disease? Because that's a whole different group. That's a whole different population that metabolizes it differently and utilize that nutrient differently. And then with the kidney function, how does it taking care of that nutrient? How does it impact the kidneys? And so there's just so many nutrients that are misconstrued because we just simply don't have a ton of research to back it up. And so when I tell people, like, it depends, or I say, well, we don't know enough, like, I'm not excited to say we don't know enough. I'm not excited to say, I can't say yes to that. But it's just the unfortunate truth that it's so new in this. I mean, even these newer guidelines for kidney disease that came out in 2020, the one that are talking about, potassium's not the devil we thought it was. And, we need to be more lab based and not just CKD based for these recommendations. I mean, that was only 5 years ago. And it, some people might think that's 5 years, but in the science world, that's a very small amount of time.
Yeah. Yeah. So how do people, I mean, obviously by your book, but how do people weed out it's interesting. It's something that's coming up for me around the oxalate conversation. When I was like knee deep in in the throes of a Lyme disease diagnosis, you come across, it's the same thing as any diagnosis. They come across all types of things that are going to cure you, everything from diet to hyperbaric chambers to bee venom therapy, like just the most wild of wild things. And I had one person online, she also had Lyme disease, and we were just talking, and she's like, yeah, I cut out oxalates. And I remember then I was like, what the hell is that? Like, and so then I had to go look that up. And then I was like, that's like in all the vegetables. I don't get it. And so and I think what saved me every time, maybe it's a little bit of laziness is what saved me, because every time I came across one of these like really extreme kind of things, I was like, I'm just not capable of like being that rigid or being that consistent, and I just was like, I guess I'm just gonna like die if that's the case, because if that's what heals you, like, I don't think I'm capable of doing that. So I guess that was a little bit of a saving grace. But it's interesting, like with conditions like Lyme disease, and I imagine the same thing will be true with long COVID and probably an array of other conditions, because I think people don't have enough medical answers. That person who cut out oxalates, like, and I'm hearing even here though, you don't have to cut them out, but maybe she had a kidney disease too that no one had found yet, or right. But then we chalk it up to Lyme disease, or we chalk it up to, and yeah, there's not really a question in here. I'm just like, I don't know. It feels hard and it feels complex, and I think people are really craving answers, which is why I think how we have someone in our administration who's really dismantling a lot of science, and because people just can't handle the ambiguity that comes along with it.
Yeah, I totally agree. And I think I've always found it to be such an interesting mentality that I typically come across in people with chronic kidney disease and other illnesses, comorbidities. People are usually asking, what do I need to cut out? What do I need to limit? What do I need to avoid? It's always about like getting rid of something. Getting rid of something is going to be how you can take care of your health, how you can better manage this illness, how you can, cure XYZ, whatever. Like, how is it always about eliminating? Like, people ask me, what foods do I need to avoid? Or, it's rarely what can I eat, even though people might put that in a comment or something, or a DM. They'll say something like, I don't know what I can eat. But it's just more, the questions are all about, what do I have to cut out? What do I have to eliminate? And I also am not really providing like questions. I'm just like, kind of, when we talk about that, it just makes me think of this mentality of like, of avoidance. That's
Exactly.
down to.
Yeah, I do. I think we're a very avoidant nation. I think our culture is very avoidant. And so that makes sense. Yes, it is always about what can we cut out? What can we not do anymore? Rather than, what can we add in, and how do we live like this full life? And I'm even hearing, I'm happy to be hearing the conversation around microplastics and how like eating plants helps you poop out more microplastics, and how, like, it's probably not great to have like plastic in your brain, but at the same time, it's not necessarily this like devil that people are making it out to be.
Yeah.
And so add in more plants, drink more water, get it like circulate.
Right. Which is also another thing as a dietitian. Like, sometimes I feel like people get frustrated when I'm like, it's the most, you want to know what to do. Like, it's the most boring thing, and you've heard it a million times, but not you, but like a person is just not open to it. But it's like, drink more water, eat more fruits and vegetables, eat more whole grains, like eat more plants, beans, nuts, seeds. But like, people don't want to believe that this could be an opportunity. They think like, what's the catch? Or like, no, there's got to be more to, like, no, because that's truly it. And that's like, that's the secret sauce behind plant-powered kidneys is, I call it plant-powered kidneys because it's about getting more plants in. It's not vegan kidneys. Some people think that they have to be totally vegan. It's not vegan kidneys, it's plant-powered kidneys. Your kidneys thrive with more plants in your diet. But the idea of including more of these things just gets so misconstrued, and people are so scared from years and years and years of being told, no, it's because of the potassium, no, because of the phosphorus, no, because of even like the protein, or like whatever it is. they're afraid of the most basic healthy advice that works for, again, 99% of the population. But it's like it's too simple. It can't possibly be that.
Yeah. Yeah, that was my next question. Is your book like vegetarian or vegan, or is it just a matter of like, are you pro animal meat or anti or yeah?
Well, I do include some recipes. It's not a cookbook, which I do really always clarify with people. Like, I have recipes, but do not buy it like you're buying a cookbook. It is the
Okay.
majority of it is information, and then I include recipes because people like to get that, but they're very simple, easy recipes. All of those recipes are fully plant-based, but you have the opportunity to include animal proteins if you like. It's another thing, again, like the research related to the current diet recommendations for chronic kidney disease say that animal and plant proteins can both fit. It's just a matter of the quantity to make sure that it's appropriate to not have so much that it's overstressing the kidneys because the protein molecule, the protein in itself is difficult for the kidneys to manage. And Americans, we are protein infatuated. Everything has to have protein, and we are getting much more than we need. So even though the guidelines are recommending around a normal protein intake, well, what used to be considered a normal protein intake, around zero 0.8 grams per kilogram, now that's considered like protein restricted just because you're comparing it to somebody who is eating like 3 times their body weight in protein. And I'm just exaggerating, but still, it's like a significant amount. So when I'm talking with people about bringing it back to like a normal protein intake, it seems wild that we are like eating so little protein. They're like, no, and you can get your protein from plants, totally from plants if you want. And you can get some if you want to add some animal protein in there as well. I have clients that do both. Like they might do animal proteins and they might not, but they still can maintain their kidney function. They can have improvements in their labs. They're not trending into dialysis. So it's just
Are there any, yeah, thank you. Are there any conditions like outside of kidney disease as well, but just any medical conditions that would either require someone to like you need to have meat in your diet or you need to not have meat in your diet, medically speaking?
um from my experience, I don't think it's there might be some situations. It's not necessarily a requirement, but if you have like iron deficiency anemia, that might be something where some animal protein could be helpful because animal foods are a good source of iron. But again, that being said, there are plenty of iron-rich foods that are coming from plants, and I have a whole article of that lists all these foods and includes a whole like basically grocery list of all these foods you can include that are plants. Um, so I feel
Or it
like
might be more like they might have this kind of iron-rich plant diet and then maybe like a supplement of meat.
yeah,
Uh,
exactly.
yeah.
Exactly. And in a lot of cases, I tell people, treat it takes a bit of time to kind of get used to it, but kind of shifting your perspective of setting up your plate. Like a lot of people with chronic kidney disease grew up like in a meat and potatoes kind of diet. Like that was how their family raised them. And then that's how they have been cooking for their family. And that's just the way it's always been. But making that switch to potatoes and meat, like as in you're having more of your vegetables and the meat is what's considered the side, not the main entree, which can be really, really hard again in our culture, in the way that our food systems are set up. And, you go to a restaurant, like that's just the way that it's been designed, but it doesn't have to be that way. And some of the easiest things that people can do is like just start by like one of the more, I would say, common or like accepted ideas is when you go to a restaurant, like ordering appetizers instead of the entrees. Like that's something that
Mm.
people will often do to either save money or to have a smaller portion or whatever. But that's an example of how you could choose something that's not necessarily like protein heavy, but it doesn't feel so obvious in that sense.
Yeah, I love that example. Very practical and yeah. And any conditions then in which case you should not be eating meat, or is it also the same thing? Like there's no condition that, well, the one that comes to mind though is PKU.
Yeah,
It's
I in the chronic kidney disease realm, the ones that I would say are going to be the most like fragile in the situation would be somebody like stage 5 kidney disease, aka end stage kidney failure, not on dialysis. Because in
Okay.
dialysis, you need the extra protein. So that's really encouraged. But to be in late stage kidney disease, which means you have 15% kidney function or less, and you don't have the dialysis helping to take over that other remaining percent that's not working, you are in a fragile state. And so in those cases, a vegan diet might be the most supportive, mainly because of the protein load. Um, but it is also still a tough balance in that if you're cutting out so much protein and so much food that you're like losing weight or you're hospitalized, you're sick, or your blood sugars are out of control, like there are situations where even that still wouldn't be appropriate. It's almost like this hierarchy of importance, right? Like which fire do we put out first? And
Yeah.
if you're really, really sick, if your blood sugars are totally wonky, like cutting out protein isn't going to help those. And it's definitely not going to help your case or what you're trying to take care of if you've got all this other stuff going on. So I would say that's probably the one in my world that I'm most hesitant on, but it's not totally out of the question either to like include some. I had a client that who was stage 5 who continued, he wanted to keep having animal proteins, and I was like, okay, let's just make sure we do this smart and cautiously. And we were able to kind of help him transition. I think he bypassed dialysis and got his transplant, so we were able to like maintain that without him having to go into dialysis. But he had some animal protein. We just had to make sure it was like really conservative and that he ate plenty of food otherwise. He ate more carbohydrates, he had healthy fats, he had enough calories to make sure he was sustaining his body and not losing lean body mass. But then he was able to bypass dialysis, which was great.
Great. Those are great examples. Anything else that we haven't talked about that you feel like would be good?
Um, let's see. I'm trying to think of like there's so many different areas and nuances when it comes to chronic kidney disease. That another one is phosphorus that I think is a bit more it's been more widely known for a little bit longer now, but even to this day, like last week I made a post about peanut butter and I had so many comments like, "Oh, you can't have that. It has phosphorus in it." And for one, a lot of people, especially on social media, they're projecting their own like food fears, they're projecting their own misbeliefs or incorrect information. And especially when I'm hearing you can't have that, I'm reading, I was told I can't have that. And
Yeah.
I want to find out where and when and who said this and who's causing these problems because that's not correct. But phosphorus is nuanced into like it's two categories. There's organic and inorganic. And organic is the kind that just naturally is included in foods. We naturally have phosphorus in our body. The beans and seeds and potatoes and grains and tons of food just organically, naturally have phosphorus in them. And then there's the phosphorus that is inorganic and it's added into foods. And so added into processed or packaged foods. And it's used as a preservative, usually, or it's included in some way to help a processed food stay stabilized and retain its consistency or whatever. That kind of phosphorus is highly absorbed and can have a bigger impact on phosphorus levels in our blood and therefore our bone health, our kidney health, our cardiovascular health. But we didn't know this until maybe about 8-ish years ago. It started becoming more of a conversation. But again, it's still to this day, there are outdated handouts. I tell people, look at the copyright date on your kidney
Yeah.
diet handout, because if it's copyright like 1992, if it's copyright 2002, if it's copyright 2018, even 2019 or 2020, it is probably outdated. It's probably giving you old, bad guidelines. It's giving you bad advice.
Yeah.
Because the foods that organically have phosphorus in it, it's not absorbed well. And in the general population, this is also something that's kind of trended, kind of like the oxalate conversation, where, so I don't know if you ever saw on social media, like there was a whole thing a while back about how you shouldn't eat oats or oatmeal because of the anti-nutrients in them. Yeah. So they're not totally wrong, but also they are. So it's great for people with kidney disease because the phytate is preventing the absorption of phosphorus. And that's what helps us be able to include these because we know that the phosphorus isn't going to be significantly impacted. You eat oats, you eat foods with naturally occurring phosphorus, we're not able to digest, to break down and absorb that phosphorus. So that's great. That is great for people with kidney disease who are able to eat more food and not have a direct impact on their blood phosphorus levels. For other people, we get so much phosphorus in our diet, like we get such a significant amount of phosphorus that we probably still benefit from not having the extra phosphorus absorption from something like oats. It's not going to make an impact, but it doesn't mean it's blocking other nutrients and it's preventing us from being able to get like the fiber from it. It's still
Yeah.
beneficial. So like it's one of those things where it's like they took something with like a kernel of truth and then they like totally warped it into something that's very inaccurate.
Yeah.
Especially for the general population.
And again, when you make something simple, people latch on to it, and people are craving simplicity. And I think it's to our demise at the moment.
Yeah. And again, it still goes back to the whole avoidance mentality of like, oh, if I could just cut this out, it's going to make it so much better.
Yeah, definitely. Well, thank you so much for sharing all of this. I will link your book below, your Instagram, all of that. And yeah, anywhere else that you want to plug in at the moment, your website.
Well, if you know people who have chronic kidney disease and are looking for a supportive group, I do have a free private Facebook group. So you can just go on Facebook and search Plant-Powered Kidneys for the groups and you will see us. We have last I checked, about 13,000 people or so in that group. It's a really supportive group. I do weekly Q&A threads. It's just a great place to like connect with peers with chronic kidney disease and get a better like positive mentality, positive support. Again, like I post something across my public Facebook page, my Facebook group, and Instagram, and the comment threads below the same content is just wildly different between all of them. In my private Facebook group is the most supportive and encouraging kinds of comments, and people are very, very excited about learning about foods that they can enjoy. So if you're looking for that kind of atmosphere, as somebody with chronic kidney disease, definitely have them check out that Facebook group.
Amazing. Well, thank you so much.
Yeah, thank you, Destiny. I'm happy to be on here and check with you.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then.